Hey everyone, I'm Claire from Pilates Claire. Welcome to the studio. Lots of people have sciatica or sciatic nerve pain, and we're going to look at some stretches today that might help with that. Firstly, please bear in mind that I'm a Pilates teacher. I'm not a doctor, I'm not a physiotherapist, I'm not anything else. I do know about Pilates, but that's it. I'm not claiming to be anything else. So if you think you have sciatic pain or sciatica, then please visit your GP, your healthcare professional, get a proper diagnosis, and they should give you some exercises and stretches that will help that are specific to you. These exercises that we're going to do are much more general. They may help some people, they might not help others. If you're doing these exercises and you feel like it's making the situation worse, then you need to stop and seek proper advice. Hopefully, some of these exercises will help, and you might find that some are better than others depending on your specific situation. So please just bear those things in mind and stay safe. So the first exercise that we're going to look at, I'm calling it a half mermaid stretch. I don't know if there's probably another name for it, but that's what we're going with today. So we're going to sit down and you're going to have one leg kind of tucked in front of you, and the other leg, your leg that's got the pain, is going to be out in front. So just move that a little bit so my foot can rest on it. So we're going to be here. I always think that, if you're going to do these stretches on one side, you may as well do them on the other side as well. But if you want to just do it on the side that hurts, then you do that. You do you. So we're going to keep the pelvis facing forwards. The leg, the straight leg, is at a kind of angle. I'm just going to keep this hand just resting on the thigh. And then we're going to reach up and we're going to reach over. And you should feel that stretch. You might feel it in your side, in your back, in your leg. You just want to hold. You might find if you turn up and look at your hand, this top hand, then that keeps you a bit straighter because you don't want to end up kind of twisting round. We're not reaching across like this. We're trying to stay up and over. So when you're holding these stretches, aim for around 30 seconds, but I personally prefer to use a number of breaths. So if you take 4 or 5 deep breaths, that's going to get you about 30 seconds anyway. But I find that if you're just counting your breaths, then it helps you remember to breathe because, often, especially if you're in pain, then you're not going to be breathing properly anyway. So really focus on your breath, count to 4 or 5 breaths, and you can repeat it, or you can do the other side, or you can try a different exercise. But it should be relieving that pain through the back of the leg. If it isn't, if it's making it worse, try something else or stop, seek proper advice. So this is our first one, like I say, this kind of half mermaid position. And you're reaching, and you slide this hand, just slides down the leg, and then you come back up. The next one is probably my favorite one to do. So you're lying down, so knees are bent, and try and keep the tailbone really heavy towards the floor. So you don't want to be all bunched up here. And then whichever leg is painful, you're going to lift that leg up into a tabletop position. So you're making a kind of right angle with your leg. Flex the foot, and then from your hip, you're going to open the leg up and just place that ankle on your other thigh. Now, that might be enough of a stretch here, and if it is, stay here, just count your breath, feel that stretch. And then if you want to increase that stretch a little bit more, you can reach through, try and keep your tailbone down, and you can kind of hold it here. Imagine this leg is kind of pushing forward. Don't actually push it. I just want you to imagine that. And you should feel that stretch. And again, hold 4 or 5 really deep breaths. and then coming back down. And again, I like to do these things on both sides, but if you want to do the side that hurts, then, just do that side. So the next one, I don't really know what it's called. I'm going to call it a bent knee hamstring stretch. And we're going to bring one knee, the leg that hurts, you're going to bring that leg in, and you're just going to hold it here. You can hold here for a few breaths, and we're going to hold behind the thigh. Okay, so we're going to keep that thigh pulling back, and then flex your foot, and we're going to start to lengthen the leg as far as you can. It won't straighten, and then lower down. I wouldn't do any more than 10 of these ones. So you're just lengthening and lowering. The leg might start to shake. So as you get here, it might start to tremble a little bit. And down. So it might feel uncomfortable, but it shouldn't feel painful. So just listen to your body. Your body knows what it's doing. Just be careful that as you start to straighten this leg, try not to let the whole thigh go forward. So you're still pulling back towards your chest as you lengthen and bend. So I would just keep the leg moving for that one. I wouldn't hold in any one particular position apart from this position at the start. But just keep that leg moving and don't do any more than 10. So for the next one, this is another hamstring stretch, and you'll need to use a belt or a band. A belt would probably be better than a band. You don't want too much stretch in there, so something a bit more supportive. I've got a yoga belt here, but any long belt will do. And we're going to loop that around the foot. So the last hamstring stretch that we did, we had the knee bent. For this one, the knee needs to stay really straight. And if you feel that the knee bends a little bit, I want you to take the leg lower down. The other leg can either stay bent here, like mine, or you can straighten it and just lengthen it down onto the floor. Either is absolutely fine. It's your choice, your preference. So we're going to start by taking this leg up, and you're going to use your arms to pull the leg up. So don't let your leg do all of the work. I want you to use your arms here and really help your leg out, because obviously it's always uncomfortable. You want the leg to stay straight, and you want to flex your foot so you're pulling your toes down towards you. Don't do this because it's not going to get the stretch through the back of the leg. So you want to push that heel away, draw your toes back. Now, if your knee bends, just take the leg lower until the leg can stay straight. Okay? And then you're going to hold for those 4 or 5 deep breaths. So using your arms to help. And then we are going to, so we've got 3 hamstrings, and we want to try and get into all of them. Because when we have sciatica, the pain runs down in between those, amongst those hamstrings, and we want to give it a little bit more room. So from here, keeping the leg straight, you're going to take the leg out to the side until you feel a stretch. Keep this hip down, so don't let the pelvis go over as well. You're going to keep this hip down, and you're going to feel that stretch. Make sure the leg is straight. Use your arms, so you're not just letting the leg drop down. That might be uncomfortable. And then again, hold for those 4 or 5 deep breaths. And then come back to the center, and then we're going to go across the other leg. So this time the hip will lift up, but don't roll. Again, you're not rolling your pelvis over. You're just taking the leg over until you feel that stretch. And this is a good stretch to do even if you don't have sciatica. These stretches are always good. Are going to help with all kinds of aches and pains. Again, holding here for your 4 or 5 deep breaths. and then bend the knee and unhook the leg. So the last one that we're going to do, again, it's going to vary for everyone. If it doesn't help you, then stick with the other ones or find an exercise that does work for you. So you're just going to lay on your front. Now, for some of you, you can do this in bed if you need to. Do it on something, have a mat down, don't just do it on a hard floor. Now, some of you might just find that this position here is too much of a stretch anyway. So if you bring your head down and then just relax into it as best you can. If that's too much, then put something under your hips, like put a cushion or pillow or something under your hips so you're a bit more supported. And when you've relaxed into it, then eventually maybe try and come out and into this laying down position so you're here. Press the pelvis into the floor and let everything just stretch out. And if that feels okay and the pain starts to go, then see if you can prop yourself up onto your elbows, onto your forearm. So your pelvis is still down and we're lifting the back up. We're lifting the chest and just trying to lengthen everything out. And then again, if that feels okay, then you can start to come up a little bit higher and a little bit higher, but do something, something that works for you. You might just want to stay here for now. And again, just hold for a few breaths, breathe into the stretch, and then that should release that pain of the sciatica nerve. So I hope that those things help you. And the main thing is to stay safe, and if anything hurts at any time, then back away from it. So these exercises are designed to release the tension, and as you breathe into it, it should ease the pain. If it doesn't, if it makes it worse, like I say, please just stop, either try something else or see your GP or physio or whoever it is that you see. But good luck. I hope that helps. And if you like this video, please like and subscribe. And I look forward to seeing you soon.